in Enfield in London. So I'm a partner in an organisation called Medicus Health Partners. It's a super partnership that covers sort of 90,000 patients. We're part of a primary care network covering 125,000 patients. So I've got an interest in diabetes, and I lead on training and workforce development for my team.
Nikhil, do you want to go next?
Hi, everyone. My name is Nikhil Ganju. I'm a pediatric consultant in the NHS in Peterborough. So when you talk about pediatrics, it's dealing with children. My special interest is working with small babies. That's called neonatology. I also enjoy meeting young budding doctors like yourself. So I indulge with a lot of medical education. And for the people who like the exciting advanced, to dabble a little bit with genomic medicine. So lots of COVID kind of questions and what testing is going on. And that's what my interests lie.
Tejas, you're on next.
Yeah, hi there. My name is Tejas, and I'm a fifth year medical student at King's College London. I'm in my penultimate year now because last year I took a year out to do an integrated BSc in imaging sciences, which is an area that I'm interested in. Obviously, at the moment, I'm still rotating through all the specialties, but I'd like to go into surgery or radiology upon graduating. And at the moment, just trying to get a lot of different experience during my time in medical school.
Thank you, everyone. So I'll now hand over to the hosts, that's Nikita and Nirvesha. Do you want to start with your Q&As that you've decided?
Yeah, that sounds good. So I think first we can also introduce ourselves a little bit. So my name's Nikki, I'm in year 13 and I'm hoping to study medicine next year at UCL. Rini, you want to go next?
So yeah, I'm Navisha and I'm in year 12 and yeah, also hoping to go into that sort of field. And I do maths, biology, chemistry and philosophy.
So I think we can get started with the questions. So we started with some sort of general questions, but also integrating some more specific questions to your roles. So I think, Rini, you want to get started with your first
Yeah.
one?
So with you, Dr. Tasu, why did you, so the generic question is why medicine, but for each of you, there's a little bit of a specialized. So for you, why did you specifically choose diabetes and sort of, yeah.
So the why medicine question is an interesting one. I guess I'm probably one of those really boring kids who kind of always wanted to be a doctor when I was little. I kind of have quite a vivid memory of wanting to do it since the age of sort of 9 or 10. I've got no medics in my family. So it was it was all very, very new. And, I sort of general practice felt like the natural choice for me because, through medical school and also during my sort of foundation training, I was probably one of those people who, really enjoyed everything that I did. So, I love the breadth of general practice. For me, I couldn't think of anything worse than seeing, the same thing day in and day out. The great thing about GP land actually is that, throughout the 15 patients that you see, you'll see something different covering the entire spectrum of everything that you learned at medical school. So diabetes, I guess, is an interest for me because, it's a massive issue. It costs the NHS billions of pounds. It's a burgeoning health issue, and it's actually really quite sort of evolving science as well. The way that we manage it today is so different to even what I learned at medical school a decade ago. So it's interesting. So that's why it's diabetes for me.
And I guess our next question was, what's your favorite thing about being a GP?
The variety. Yeah. And my team, actually, I really love the people I work with. So yeah, they're the two things for me, the variety and my team.
Right. Thank you. I think Nikki has some more questions.
Thank you. Dr. Nikhil, I just wanted to ask you a little bit about why you chose to specialise in neonatal, but also paediatrics. What was it about those specialties that made you interested?
That's where, when I came to the country, I trained in India, did my primary medicine in India. I came over here, I was quite open to a range of specialties. Interestingly enough, my first job was in surgery. And I'd gone down the route of taking them surgical exams. And I really enjoyed what I was doing because I'm the kind of person who likes to go there, have the excitement of working and making a change. And as part of our role, while we are working in an organization, we're supposed to get a 360-degree feedback from lots of people. And what I got to know later from one of the nurses was, you're going to beat me up for this stages, but she said, you're too good to be a surgeon. That's what she told me. And I went to her and I said, what do you mean you're too good to be a surgeon? And she said, we bleep you once and you're there to speak to the family, or you're there and you're unlike a surgeon, you won't survive in surgery. So following that, I did kind of introspect, and I found out that whenever I covered the pediatric surgical wards, I really enjoyed myself. And the part I enjoyed was I could just not be serious all the time. Being a doctor, when you're thrown away into the real world of practicing medicine after you become a doctor, you realize you have a lot of responsibility on your shoulders, and many a times you're forced to grow up really quickly. So when my friends who'd done the engineering were partying out over the weekends, we as doctors were saving lives, literally saving lives. And I realized my niche was working with children, and more specifically with small babies. I enjoy the excitement of getting them better. And as Deepti was saying, she likes being a GP. So I consider being neonatologist a GP for small babies, because we care for them from the moment they're born till the moment they go home, and as a follow-up when they come into our clinic. So we are specialists and we know what's going around with them, like our GP colleagues know about what's happening with the grown-ups. So that's why I enjoy neonatology, and it brings the excitement. So you go in and you don't know what's going to happen. You work as a team, and there's no dearth of chocolates and cakes. There's always chocolates and cakes on the unit.
On from that, do you think, have you ever had any difficult moments in pediatrics? Because I can imagine there must be some difficult cases as well on the other side.
Yeah. So as I said, the spirit of pediatrics, and more so with neonatology, is team working, and that's one thing which sees you through your difficult times. I think the most difficult times are where you have to break bad news. That's in pediatrics. So we have difficult diagnosis where we know the children won't pull through, and it's not only about the patients, about the family, and making it the best possible with those experiences. When it comes to small babies, sometimes we've got these extreme premature babies. You hear about them on the news, the 22-weeker from Japan who was born 18 weeks early and goes home really well. But we don't have so many success stories with the extreme premature babies. So managing the expectations of the family uh, who've been waiting for this baby to come, and sometimes they don't pull through, and having those difficult, honest discussions with them is heartbreaking at times. But we pull through because of the teamwork.
Thank you. Rini, you want to ask the next question?
Yeah, so you mentioned that you also studied in India. So how do you find a difference between sort of education in India and over here?
So I'm in the UK as a child because my father is a doctor and he trained in the UK. So I knew what I was coming into. When I had to come to the UK, I knew that England was going to be like second home to me, as it was not a foreign land. When we talk about medicine in India, I think it gave me the launchpad to have a successful career over here, because there's a lot of in-depth learning that happens. A clear example of how the differences are there is when in India you've been given a case and you're supposed to give the differential diagnosis, the various problems that the patient could be having. You're encouraged to think of the 10 to 15 different differentials that could happen, uh, that are possible, and you're encouraged to think of the 5 rare ones. Whereas in England, I think what rightly is the focus is to think about the common things and not to miss the common things. So that was a major difference. So you're applauded for not missing the the likely diagnosis, you're not applauded for giving the 3 rare diagnoses first. So that was a mindset change which we need to have. And I think luckily with the kind of environment I had in India, there was a lot of focus on medicine with a lot of communication. So I worked my internship, my foundation year training in a hospital, which had similar kind of work ethics as in the NHS. So that wasn't a big culture shock for me. I was used to speaking to families and explaining my decisions. So other colleagues of mine who've not worked in that environment found it difficult to move to an environment in the NHS where most of the time they're explaining what they're doing and they're questioned about the decisions. So that's a change other of my international medical graduate friends find over here.
All right, thank you. Nikki, do you have any other questions?
Yeah, so Tejas, I just wanted to ask you why you chose imaging sciences for your BSc in third year?
So that's a really good question. I think when you're choosing your BSc, it can be quite difficult because there really is so much choice. You don't just have the ones offered by your own university, but you can apply to almost any other university in the country. So it is a case of looking through all the different options and making a decision. For me, I've always had an interest in sort of like radiology and surgery, and it came from the belief that I think imaging is such a big part of medicine nowadays. Nowadays, anyone who comes to the hospital, the majority of the time, they're getting some sort of imaging, an X-ray, a CT, an MRI. And doctors really do need to be quite aware of like the pros and cons of each imaging method, which is definitely a change from say like 50 years ago when these things didn't even exist and it was all based on the examination, speaking to the patient. I think it was really valuable just sort of learning how these techniques can be applied to different parts of medicine within different specialties. I learned a lot about, I guess, the maths and the physics behind how the imaging methods work, as well as their clinical application as well. And the teaching was incredible for it. And that's something that I was aware of based on speaking to older people in my medical school who had also done it.
Yeah, that's really interesting. I think it's a good point about seeing medicine from a different perspective in that way. And also, we wanted to ask a bit about King's. What's it like there? And what's your favorite thing, least favorite thing maybe about studying there?
So I guess you're planning to go to UCL, so maybe you're not a massive fan of King's, but King's is honestly great. I think just every single part of it really does suit me. There's obviously quite a strong academic focus. A lot is expected of you academically in terms of exams, clinics, and just being a very good medical student. But then I think outside of the degree, there's just so many opportunities. Part of that comes from, I guess, the location being in central London, in terms of like social life and extracurriculars, things you can do. I think it's the best university for that. I'm really lucky to have a lot of people in my year on the course who are just really, really great people, very nice human beings and very ambitious people who can sort of push me a bit more. There's always people who are just willing to sort of help you with teaching, with work. There's a great sort of older boys network as well of older students or former students who can help you with any issues you have. So I think it's just a really great place to be a medical student.
Thank you. So I think we'll move on to some more open questions now. So I just wanted to ask, I think it's quite well known that in Indian/Asian culture, there is this kind of pressure, not pressure necessarily, around studying medicine or similar vocational careers. Do you think that's had an influence in your decisions, or what's your opinion on that situation? Obviously, I can't generalize and speak for everyone, but I think it is something that should be spoken about. So Dr. Nikhil, would you like to go first?
Am I going first because yeah, so I was quite lucky that way. My parents were quite open and they said, Nikhil, do whatever you want as long as you can have a successful career. You can do medicine, engineering, law, and I think there were 2 or 3 other options. And I was like, that's really generous. You're giving me more options than most Kashmiri parents do. But honestly, when I was thinking of a career, I had, so you have the entrance exams, you take the exams in India. So I'd applied for engineering, medicine, because I had the subjects to apply for both. I was offered positions in both. And initially, while I was waiting for my medical university placement, I'd already taken a a backup placement in one of the good colleges for engineering. And I always knew I wanted to work with people. So engineering to me didn't mean the best option for me. I had applied for law, but I was certain that if I had to do law, I had to do it from one of the best universities. And unfortunately, I didn't get it in the first list. I was in the backup list. So out of the options, I chose medicine. But I've seen lots of colleagues who come into medicine and they feel that they're forced into it. There's some people who find their niche. So I worked with a lovely Asian doctor who really didn't want to be in medicine, struggled through university, didn't look happy. And he found his interest because he was a very technologically savvy person. He found his interest in radiology, because for him, radiology was where he could work with machines. He understood it much better than most of us do. And he's an amazing radiologist in the UK. On the other side, I've got another friend from a very influential family who has a career as a GP, and the career as a GP gives him the flexibility to have a part-time career in something else that he enjoys. I've worked with another midwifery colleague who was a part-time air hostess for Virgin Atlantic, and she used to work part-time as a midwife. So there is flexibility later on in life if people get forced into it. But medicine long-term is a career for somebody who enjoys what they're doing, because when you're waking up at 3 o'clock in the morning to go and support your team, you can't do it unless you really enjoy it.
Yeah, I think that's really important. Thank you. I think, Dr. Dipti, would you like to say anything about that?
Yeah, so I guess, I completely chime with this notion that actually I think you do need to want to do it. I was fortunate that actually my mum and dad were really sort of, yeah, sure, medicine, great, why not? But I took, I did the usual kind of A levels, but I also did art A level, and I was so passionate about art. I really, really loved it. And there was maybe 2 or 3 months as I was edging towards applications for university, when I said to my parents, I was like, guys, I might think about doing an art foundation degree, just put it out there just to see what they said. Yeah, the smiles kind of fell from their faces, and they were like, well, do you think you might earn a bit more money as a doctor? Maybe one day you could continue art as a hobby. So it's still something that I enjoy, but I'm really, really totally agree that I think you have to want to do it. It's not for the faint-hearted. Medical school's tough. I went to King's as well, so I completely agree with what Tejas said about King's as a medical school. It's fantastic. And actually F1, F2, the sort of postgraduate training is tough too. And that notion of kind of flexibility and things getting better, it takes a long time to get there. That those early years are really difficult. And I think if you don't really want to be there, that's really tough. Given during the COVID pandemic, everyone's really sort of struggled with their mental health. And can you imagine having that as well as not wanting to be in the place that you're working in, day out. So I would really stress, only do it if you think you can, if you think you want to.
Yeah, I agree with everything you said, 100%. Tejas, do you have anything to add?
Yeah, so I think it's an interesting discussion. So I actually sort of come from, I guess, a medicine family. Both my parents are doctors. My brother's also in medical school, and other relatives in the medical field. I think definitely when you're growing up, there is sort of that pressure, like you said, where if you have a lot of people in the field, it's always on your mind, oh, okay, maybe I should go into that as well. And especially when you're doing your A levels, if you're doing the classic sciences, biology, chemistry, maths, there is sort of that notion that, you should just go to medical school. Those are the subjects you do, you should then go to medical school, which is completely not true. There are so many other things you can do with those subjects at A level. I think, like has already been said, you really do want to do it, because I'm in my 5th year now of medical school, and obviously I have friends who have graduated now, who are working, and that can kind of be difficult, just sort of seeing your friends progress with their lives, get high-flying jobs in the city, think about, I guess, more grown-up things like putting like deposits in for houses, things like that, where you're still in medical school, like 9 to 5 on the day, like during the day, going to clinical placements. And then it doesn't necessarily get easier as well. You have F1 and F2, which can be quite difficult from what I've heard. And it really is a long slog. I would say the good thing about medicine, though, is there really is something for everyone. I think Dr. Nikhil highlighted this. In fact, sometimes I feel like there's almost too much choice. Like, it's hard to narrow down what do you want to do as a doctor, what kind of specialty you want to be. But I think it is sort of going back to the original question, it is going to take some time, I think, to change this notion, I guess, within Asian households of like forcing people to do medicine. It really must just be something that you want to do yourself. Otherwise, it is going to be a struggle. And I know people during medical school that have not completed the degree or decided to drop out or take some time off because they've realized, you know what, this isn't for me anymore. Yeah.
Yeah, thank you so much. Rini, you want to go into the next one?
So my question was, have you, or I know most of you might have had patients or like family members mostly approach you during like events and like family gatherings with their problems. So do you have any like funny stories or anything like that? Dr. Nikhil, if you want to go first.
Funny stories, not many. I'm happy for people to share my number if I can be of any help, because people will only contact me with a medical question if they're really struggling with some advice they've got elsewhere. So I've got friends who give their numbers to friends and friends who are abroad, and the least I can do is help them out. For me as a pediatrician, obviously the longer I've been in this subspecialty, the lesser I am familiar sometimes with I call it adult medicine, and I get approached for all these questions about some vague drugs which I've never heard of, because things have evolved since I left normal medicine. So I have to kind of sneak onto the site and Google the name of the drugs, and especially when it's queries from India, because in India they don't use the generic names of the drugs, they use the company names, which don't make sense. So I have to sneak away. So if you're asking me a question and I'm sneaking away on going on Google, that's because I'm looking up the name of this drug which I've never heard of before. So that's funny for me.
Dr. Tisu, if you want to go next.
Yeah, I mean, that's an interesting question, because I have to say I actually find that dynamic quite tricky. The sort of questions from friends and family. It's something that's never sat very comfortably with me as a professional. So, come have a look at these blood results, have a look at the CT scan. Yeah, okay, I can, but my advice at the end of the day is, I really think you should go and see your own GP, or go and see this is what I think roughly, but please make an appointment to go and see your own doctor. I don't think I've got any particularly funny stories. Yeah, sorry to disappoint. I don't think I've got any good ones.
All right, Tejas, would you like to add anything else?
Well, I mean, still being in medical school, I guess this happens very rarely that someone will come to me specifically about any medical problems they have. The rare occasion it has happened, it's sort of the same idea that there's different people you can speak to, like speak to your own GP, or like other medical professionals you're involved with. I don't have any funny stories, unfortunately. Maybe in a few years when I've graduated, I'll have some more.
That's a very interesting point that you brought up, and I think I should just add on one important thing. So the people who are listening to us, they may be the future doctors, and remember one thing: your opinion may be different from an opinion they've got from another doctor elsewhere. Always be professional about it. So I've been in the middle of conversations where people are slagging off somebody else's decision, but that could be you whose decision people don't agree with. So always do it professionally, so you can give your own professional input into what you think should happen over there. But as Deepti rightly mentioned, direct them back to their treating doctor, because you can't be their remote doctor at the end of the day. So just be professional about it. It gets very awkward when I've seen previous discussions where you're openly kind of dismissing the opinion of another professional.
Thank you. Nikki, you had the next question.
Yeah, so moving on, I wanted to ask, what kind of misconceptions did you have about medicine before you got into it, and anything to do with that? Dr. Dipti, would you like to go first?
Okay, so I guess I can start with general practice, because I think there is huge misconceptions around general practice. So, you know, I still have, so my new GP registrar, who started the other day, you know, she was having a conversation with me about starting general practice and how her family, I think she's the first medic in her family, and there was conversations about, oh, you know, are you sure you want to be a GP? You know, you could do lots of other things. Not a great, you know, you'd be a bit of a failed doctor, you know, if you turn into if you become a GP. And actually, it really saddens me that that perception is still out there. I challenge anybody who does a hospital job to come and do my job for a day. You know, I can't stick someone in a CT scanner if they have a headache. I just can't. I don't have immediate access to blood tests. I don't have immediate access to chest x-rays. You know, so actually, in general practice, we're often seeing patients right at the beginning of their disease journey, you know, with really kind of often subtle signs and symptoms. And often you know, by the time they get to hospital, it's there. You know, you can stick them in a CT scanner and, oh, look, they've got a lung cancer. But actually, when we see them in general practice, it's often years, months before that. And it's our job to try and identify them at that stage. And actually, you know, Nikhil was talking about differential diagnoses. You know, when I'm speaking to my registrars, if they come to me and say, oh, I think it's likely to be this, I'm like, you haven't done your job properly if you can't give me at least 5 things you think this is going to be. Our job is to think laterally, really, really broadly. And, you know, I guess what I think, you know, the thing that I think GPs often get branded with is being the people who see coughs and colds. Actually, GP land has changed dramatically. You know, we have paramedics, clinical pharmacists, you know, nurse specialists who do all that stuff. And actually, the GPs are left with a really complex patients who have got a gazillion drugs on their drugs list and, you know, 15 comorbidities. You know, they're the patients that we deal with. So for anybody who thinks general practice is boring, I would really challenge that. And I think if you want to be excited every day by the patients that walk through your door, come and do GP. Honestly, it's great.
Yeah, thank you. I agree. I think the importance of primary care, it's something that people should need to be aware about. Also, I wanted to ask, what's your, have you had any interesting experiences being a woman in medicine? Do you think you've ever been treated differently or not even?
So yeah, I mean, I think you know, sexism in medicine is still a thing. You know, there's still a gender pay gap, and you know, I think, you know, particularly as you progress and you know, so, you know, once you're a registrar or maybe even an SHO and you get married and perhaps choose to have children, there is still, you know, I'm sure, you know, Nikhil can probably speak a bit more about this, but, you know, there is still, you know, rolling of eyes actually when a mum, you know, when a doctor rings up and says, oh, my child's got a temperature today, I'm really sorry, I can't come. You know, I can't send them to nursery. You know, I do think that actually women are treated differently. I think it's better than it used to be, but I think we've still got a long way to go.
Dr. Nikhil, you would like to add anything?
Yeah. I totally agree with what Deepti said over there. Having initially been in surgery, I could see how the female trainees had to work doubly hard and prove themselves. And listening to the conversations in the background, it was quite awkward at times. I think things have moved on. I'm quite old now. This was over 10 years ago. Luckily, in pediatrics, it's a totally different ball game. So my last job in my training was somewhere where I was the only male doctor in the team. So I was the minority. I was the one being looked after over there. Pediatrics is more female trainee friendly. I've had colleagues who've gone through the yearly appraisal where they've come out saying, oh, I've had my first child, I've had to go part-time. And they're encouraging me to have my second one because they know I want to have a second child. And where else will that happen? We've had lots of heads of school for the nation, for pediatrics who are very eminent as female doctors. So we are very blessed in pediatrics. If we ever have a phone call from a trainee that their child is not feeling well, we cover the gaps, and the WhatsApp group goes alive with everybody wishing well for that family. It's a sea of change in pediatrics, and we've got lots of GP trainees who've noticed the change. But I think these are changing times. With time, things will improve for everybody. It won't be as different as it used to be 10 years back.
So you mentioned how in surgery there's quite a small percentage of women, and pediatrics on the other hand has a much larger percentage. Why do you think there is that difference?
I can't answer that question. I wouldn't know, but the only thing I've seen from my other colleagues around is when they go through their medical school rotation, that's number one. So they notice that it's a more friendly environment. They feel less threatened. Lots of my other colleagues have said that apart from GP world, where they take into account flexible working for the future. So for lots of female trainees, for some reason they consider that they would at some point need to take a little bit of a backseat and go part-time. So they feel that there's more flexibility with job sharing in pediatrics. However, having said that, I said in pediatrics, male trainees are minority, and somebody I work with has taken the decision that he's going to go part-time in his training so that he can support his wife finish her training early on. So things are changing. People take shared parental leave. And that's going to happen across all specialties.
Thank you. Really, you want to move on to the next one?
Yeah, so what are sort of any misconceptions that you had before starting medicine? Any sort of regrets, or is there any part that you regret doing in a way, if that makes sense? So Dr. Nikhil, if you want to go first.
So before I joined medicine, I thought medicine is going to be about dressing up smart and walking onto the ward like they show in the Bollywood movies. I came to the UK, and anybody who knew me when I started working in the UK knew that I love my ties. So Secret Santa, easy gift to buy Nikhil a tie. Birthday, buy Nikhil a tie. And I had all these ties, and I used to work in the cardiac surgery ward at the time. And all the old ladies used to look out for me because they wanted to, elderly ladies used to look out for me because they wanted to see what tie I'd worn. So the misconception was that you dress smart, you go there, you wear your suits, and you look good. But then we've got the massive keep your hands clean, bare below the elbow campaign, where we were not allowed to wear ties. So it's back to simplistic working and wearing a lot of scrubs. Luckily with COVID-19, since we wear scrubs now and we've got our face masks, which looks quite threatening to young population, we moved on and we started wearing animated scrubs. So I've got a Star Wars Lego scrubs, I've got a Wall-E scrub, and I sometimes forget that I'm wearing that on the ward rounds in the neonatal unit, and I've got these parents smiling at me, and I forget that they're smiling at my scrub and not me. So you can bring a little bit of your eccentricity and your personality to your work. So that was one misconception, that I thought I can dress smart, but I'm dressing different.
Dr. Tasu, what about you?
So misconception. So I guess one was that, perhaps general practice might be better for work-life balance. That's a lie. That is not true. You can, I frequently am at my desk by 8 o'clock and sort of drag myself home at 10 p.m. on my long days. So, it's a really, it can be a really, really long day. I think the big thing I think is, I think when you do your A levels, you go to you apply to medicine, you do medical school, and it almost feels like you're on this kind of race to get to the end. And I think the biggest thing, if I look back, I think actually, do you know what? There's time. There really is time. So if you want to take a gap year, take a gap year. If you want to do a BSc, do a BSc. If in between F1 and F2 you want to locum for 2 years, do that. Actually, that life experience makes you a better doctor. So that's the one thing that I would say, that actually, don't feel like you're on a treadmill. It's okay to step off the treadmill. It's it doesn't have to be a race to the end.
Thank you. Tejas, do you have anything to add?
Yeah. So speaking from a medical student perspective, I think the biggest misconception that people have is that you can go into medical school already knowing what exactly you want to do in medicine. And I think everyone is guilty of this. In first year, you speak to people and they're like, oh, I want to be this specialty. I want to be like a pediatrician, a surgeon. I want to be a cardiologist, without really having much clinical experience. And I think that's a problem because it means you don't necessarily open yourself up to all the different options you have within medicine. I mean, I couldn't tell you personally what I wanted to do when I was back in first year, but I can tell you it's definitely not what I want to do right now. Your mind just changes so much throughout medical school. And I'd say like one of the biggest regrets I had is sort of not identifying that a bit earlier. I think from the start, you want to just acknowledge that, you know what, like I need to just get experience in a number of different things so that I can just figure out, oh, okay, like this is what I'm interested in based on actually having time in the hospital with those kind of doctors, seeing exactly what the day-to-day life is like, instead of just relying on what you see on media or what you think the general day-to-day life is of certain specialties.
Yeah. Nikki, next question, please.
Yeah, so I think we could move on to some more topical questions. So I just wanted to ask, what impact do you think COVID has had on your working life as a doctor / medical student? Tejas, you want to start?
Yeah, sure. So I guess if we're going back all the way to last March, so 1 year ago, the immediate impact it had was nobody was going really into placements anymore. The exams got all changed to online. I was intercalating at the time, so luckily that didn't really affect me as much. But even looking more recently, clinical placements are very different. There are certain things you're just not allowed to do anymore as a medical student because they deem the COVID risk to still be quite significant and they don't really want to expose you or other patients to that. Looking more specifically, it has been, I guess, interesting getting accustomed to wearing masks on the ward. Sometimes the patients say they can't really hear you or understand you properly. I recently had to do a mock clinical exam wearing full PPE, which is a unique experience. And there is obviously that danger and that sort of worry you have that because you're not getting as much clinical experience, that when you graduate, you're not going to be as well prepared to be an F1 and F2. And that's definitely something that's been echoed to me by the people in the year above me who have now graduated, who will be becoming F1s in September, who feel like because of COVID, they did miss out on so much patient contact and just learning what the day-to-day job is of a doctor. There's that feeling that I'm not going to be able to make this back up and I'm really going to struggle. So I say that is definitely the biggest impact it's had.
Thank you. Dr. Dipti?
So I just wanted to say something in response to Tejas, actually, that I think, I don't think it really matters how much clinical experience you get in your final year. I don't think anything can prepare you for day one of F1. I mean, it is a baptism of fire, and you will, within 2 weeks you'll be like, oh wow, I'm great at cannulas, yeah, it'll happen, so don't stress, you're going to be just fine. You really, really are.
That's reassuring to hear. Thank you.
Yeah, no, you absolutely will be. I think, sorry, you have to remind me what the question was again.
It was just about impacts that COVID has.
Yeah. Oh, right. So yeah, so general practice, it has changed beyond recognition, actually. So we have, I think it's driven innovation. So, we are, I think it's really kind of increased the use of technology. I mean, general practice was pretty good, I think, in terms of technology. We've been paperless for years now in terms of electronic notes and stuff in GP land. Electronic prescribing and all of that stuff, we'd been doing that for a really, really long time. I mean, by comparison, hospitals are a bit more behind the curve. But, in terms of, we used a lot more technology to kind of communicate with our patients, so kind of video calls and, all those sorts of things. And I think the interesting thing is, I think it sort of changed patient expectation a little bit as well. So, for years and years and years, general practice was a service that was really, really driven by patient demand. And actually COVID has kind of turned things on its head a little bit and put the control a bit more back in the doctor's court. But I think as things return to normal again, there's going to be a bit of tension about where that balance falls. But it's been fascinating, and it's been great to have what I think it's also given a bit of flexibility. It's given doctors flexibility to juggle things about and actually do some proactive work, which is something we never really had time to do. So although it's been an awful year, there's definitely been some good stuff, good changes that have come out of it, definitely.
Yeah, I think that's a really nice way of looking at it. Although it has been difficult, there have been some positive outcomes. Dr. Nikhil, would you like to say anything?
Yeah, I totally agree with everything that's been said so far. COVID's really changed the way we interact with people, how we deliver the service that we have to. Just picking apart a few points. So in most of our jobs, we are patient facing. And in my head, I think, how can somebody trust us if they can't recognize us in a crowd? So whenever I'm interacting with a patient, maybe on the ward or in outpatient clinic, I make it a point to pull out my ID badge and I say, this is how I look behind the mask. First thing, it gets a smile on their face. They're less anxious about it. And secondly, if the masks ever come off, they'll recognize me. How can they trust me with their child unless they know who I am and how I look? So communication is an important thing. On the aspect of communication with the PPE, sometimes you've got the big masks in a difficult situation, and luckily or unluckily, when we had the PPE rollout in the NHS, I was on call for that week. And one challenge we realized very early on is when we are all gowned up and you've got the big mask in a research situation, people can't hear you, what you're saying clearly. Instructions are missed. So we had to run simulation. This is the role of simulation. I like medical education. I talk about simulation, where we had simulated scenarios where we were using full PPE to communicate with each other to make sure in the next research situation, people can hear what we are saying. Now, with innovation has come virtual appointments. It's wonderful because I can sit in my office and I can see people on a video and I can communicate with them. They're not dragged into hospital to reduce the footfall of lots of people coming in. That has its benefits, but the issues being that sometimes things get picked up a little bit late. So it's what we're learning to judge is who can be seen appropriately in a video and who needs to come in. And that brings me to the last point. Being a hospital physician, you've got lots of people in the community. It may be the support team around a child or a family who have also moved to a virtual environment. So many a times, by the time they've been seen in a few virtual appointments, they come to us. My main worry when I lay a hand on them and I see them face to face is, have we delayed processes because everybody's seeing them virtually? And in my head, there's no substitute for laying your hands and doing a proper physical examination. So hopefully, when things go to a near normal, we'll go back to the proper laying your hands on, examining the patients, and we can use appropriately the video and virtual consultations where we think it's safe to do so.
Thank you. Rini, you want to ask the last question?
Yeah. So with obviously you said you were quite interested in COVID, Dr. Nikhil. So what do you think the impact of COVID has been, and sort of the vaccines and the vaccines effects, as along with like children and just us in general missing out on opportunities?
That's a heavy, loaded question. So talking about the simple things. So when I do a baby clinic, when we had the first wave of the pandemic, the children would look at their mum with the babies would look at their mum with a mask on, look at me with a mask on, and having moved on a year forward, it's nice, but it's sad when I see babies coming into clinic who've grown up throughout the pandemic. They may be 3-4 months old, and if I interact with them with my kind of vocal voice changes and I do funny things, they react even though I've got a mask on. Babies should not be doing that. They should be looking at your lips. They should be looking at your expressions. And it's funny, but sad at the same time that we've got a new crop of babies who are responding to people with masks. That's on the human front. I think as the NHS, it's difficult. We've had a backlog of patients. We've got lots of wait lists for various procedures and surgeries. That way, we were very lucky with pediatrics. When all our clinics were cancelled, all of us were calling around our families in our free time and clearing out the backlogs, making sure people were safe. If they were not safe, getting them in. That's how we work as a specialty. So our backlogs were not too bad, but thinking about my surgical colleagues who had to cancel all their surgeries and have got all the numbers backing up, it's just, but as always, there'll be a way around it.
Okay, and the last question, just to end this, is what is like your one top tip for anyone who's aspiring to get into medicine? Dr. Dipti, do you want to start?
So top tip. I mean, I would really say, if you're interested and you want to do it, go for it. Really, really believe in yourself. I think, make yourself, I think, in terms of applications to medical school, make yourself stand out. And that's really, really difficult to do because everybody plays the harp and the violin these days, apparently. Really don't be afraid to be different, and make yourself stand out. And that, alluding also to that thing that I said before, is that don't be afraid to step back and take your time as well. So if you want to have a gap year, think about having a gap year. I think it's such good life experience, and actually people with life experience make better doctors. I think there'd be two things I'd say.
Tejas, do you have any sort of tip?
Yeah. Speak to a lot of different people at maybe different stages of their medical career. So speak to people who have just started medical school, speak to recent graduates, junior doctors, consultants, just everyone to get a flavor of what the degree is like and also what the job entails later on. Obviously, you have all the things you need to write in your actual application. So you need to study hard, do well in your A-levels, all of that stuff. Extracurriculars, but I'd say before we do any of that, you should be 100% certain this is the degree and career you want to do, and that comes from speaking to people who are experiencing it firsthand.
Thank you. Dr. Nikhil, do you have any top tip?
I totally agree with the points already mentioned. I do a lot of work for the region, the East of England, as the pediatric lead on social media. So I interact with lots of young people who are aspiring doctors or people who are aspiring to be pediatricians. And I think the one thing I always say is never lose your human touch. Always have a smile on your face when you go and interact with a family. Half the battle is won if you win over the trust of your patient. I think you hear about all these inspiring stories where people who really want to become a doctor try again and again and reapply. So never give up, because the common misconception is you need to be super clever to get into med school. Yes, you need to get your grades as Tejas mentioned, but you need to be showing some grit and determination. And if you want to get there, nobody can stop you. So anybody can be a doctor. It's not only for the so-called people with just exceptional grades. If you want to do it, you'll find a way to do it.
Right. I think that concludes all of our questions. And I really quickly just wanted to say thank you for all of you to take out your time and just answer our questions. I think we overran just a little bit, but yeah, thank you so much.
Can I just conclude by saying thank you, especially obviously to the hosts who are hopefully budding doctors, and a special thank you to Dr. Dipti, Dr. Nikhil, and Tejas for sharing your insights and your personal experiences with the children who are probably watching, and also the hosts who are interested in the medicine field. It's been actually quite, I like the certain points like you made, don't be afraid to be different and don't lose your human touch, keep smiling. I think that's one of the key things you have to remember a doctor has to have, because the human touch is very important for anyone who's going to be treated for something they don't know what to do about. So anyways, all the best to all the children who are aspiring, and thank you once more. Thank you for coming on to this event.
Thank you for having us.
Thank you, everyone.
Bye.
Thank you.
Thank you, Anu, for organizing this.
My pleasure. Thank you.
Thank you, everyone.
Okay.